discussion on the book Global Health in Global Health Practice, Investing Amidst Pandemic, Denial of Evidence and New Dependency by Dr. Olusoji Adeyi. And if you have any questions, you can put it in the comment box or the chat box, and you are free to ask any question. And I would like to introduce the chair for this occasion, Dr. Franny Lutia. Franny is a highly experienced and well-known finance and developmental expert leading and transforming organizations in the public, private, and non-profit sectors. Currently, she is a senior partner and executive vice chair at the Southbridge Group and also the CEO of the Southbridge Investment. Her career at the World Bank saw her hold senior financial position, including chief of staff to the president as well as the vice president. She has served on different boards in advisory and governance positions, including the UN Foundation, World Economic Forum, Regional Advisory Group for Africa, MIT, OCP Group, African Economic Research Consortium, Institute of Security Studies, and the King Baldwin Foundation, US. She has several publications, including Leadership in Globalized World, Complexity, Dynamics, and Risk. She is a distinguished professor at the Sciences Po Paris and lecturer at MIT. She holds a PhD in engineering with a thesis on infrastructure systems and MS in transportation from MIT, as well as doctorates in human letters from North Central College and a doctorate in law from Lancaster University. Dr. Franny is pleased to have you here, and I will appreciate if you can make your opening remarks. Thank you.
Thank you very much, moderator. It's a real pleasure to be with you today. There's some travel disruptions, which is causing me not to be able to show you my video as I'm on the road to catch a flight, and I apologize for that. I was very excited when I was invited to offer some remarks to the discussion on this really excellent book by Dr. Adeyi. I really was happy to read it, and I wanted to prefix my remarks through two periods, BC and AD. BC meaning before COVID, and AD meaning after Donbass, because we have the war ongoing in Ukraine. So before COVID, in the BC world, there was a lot of excitement around investing in health in Africa, but most of the funding actually went to the architecture of the health sector. And it's only after the BC period, after when COVID came through, that we've seen a shift in the last few years in the patterns and nature of funding that goes to the health sector. So more generally, donors have been basically focusing on a few things in the BC world. They've been looking to strengthen health institutions. You see, for example, what was done by US bilateral aid to Africa. It went to strengthen local institutions. The Bill and Melinda Gates Foundation invested heavily in that space. There was a lot of reliance on domestic resources for the whole health sector, but it ended up crowding out other types of focus areas in the health sector, which have created perhaps more of a pattern of recognition when Africa then had to deal with very complex communicable diseases. So you take then, before COVID, we had Ebola. When Ebola came up, the very first sources of funding that came to the table came from African resources to start with, and then others came in to support, but mostly Ebola was handled through domestic investments. And what I wanted to highlight there is that the previous patterns of focusing on single diseases to support African nations to build the capability to handle those came in very handy during the Ebola phase, even though those investments were actually made for something else. So you take the example of polio in Nigeria, the capability that was built to deal with polio became very useful in dealing with Ebola, because the same protocols, institutions, ways of doing were relevant. And therefore, even though the investments were single disease type investments, they ended up being very valuable for a new type of communicable disease. And then, of course, when you then look at how people handled the risks that they were facing, they mostly had to pay for healthcare out of pocket, with very limited insurance and other mechanisms for paying for health. It falls really on a trade-off between, do you eat, do you send your kids to school, or do you pay for healthcare? So then we have the COVID world then come in. And there you notice that, first of all, initially, there was very limited funding going to Africa for COVID, because every country was trying to figure it out for themselves. So there's a very slow uptake in foreign investment into Africa to deal with the particular challenge that the continent was facing. However, when countries had figured it out in terms of understanding a little bit the disease, then you started to see funding going to testing and tracking. But there was very limited support going to vaccines until, of course, there was an AU-led initiative with AfriExim and the African Development Bank and others to put together facilities that would then support countries in purchasing vaccines. And you see also country leadership coming up, like in the case of South Africa, with President Cyril Ramaphosa coming up with domestic solutions and then figuring out how to support neighbors in handling the costs that is needed to be tackled with the purchasing of vaccines. And then later on, you saw an IMF facility coming in, with the IMF showing a degree of flexibility that I have never seen throughout my career to support countries to deal with COVID-19. That's because it was a communicable disease that was having global implications, and therefore there was an interest to find solutions to support that kind of intervention, and investment therefore came in. Nevertheless, with all of these efforts, as we speak, only 20% of Africans are vaccinated, which means there is still a lot to assess and review in terms of the other constraints beyond the funding and other reactions to that. So then let's move to the AD world after Donbass. After Donbass, with a war ongoing in Ukraine right now, the majority of countries are focusing on their own constraints. The energy crisis in Europe, being able to subsidize the households before the winter strikes, has had a big impact on the reduction in aid, bilateral aid in particular, that is going to developing countries and particularly to Africa. There is also reductions in and changes in strategy. For example, moving from 0.75% of GDP to 0.5% of GDP going to development aid in the case of the UK. But on the other hand, you see a pivoting by many countries towards South Asia and Africa, focusing on these two regions, and therefore an expectation that there would be a stronger support going to these two regions. So what does that do then in leaving the other health-related risks, road traffic accidents, cancer, diabetes, heart disease, high blood pressure, all these lifestyle or non-communicable diseases, and even more recently, mental health, which has become a big crisis in a number of countries. All of these health risks have to be faced through domestic resources and by individuals with out-of-pocket financing. And I think I will stop here in the interest of time, because I think when you look at these, before COVID, the situation was institutions, single disease eradication. Then you have also during that time, you have big interventions like the PEPFAR program by the US, which really put massive investments in HIV and AIDS. And then, of course, you have the Global Fund, which took over malaria, tuberculosis, and HIV and AIDS. So those diseases got a lot of funding, a lot of attention. The Global Fund just closed the largest single fundraise in New York recently. So that's a massive contribution. But then you see these other areas that are left orphaned, where people have to pay out of their pockets. And the AD world after Donbass is going to be even more challenging given the restrictions we are seeing. So Dr. Ajay, I'm looking very much forward to hearing your book launch and the arguments you make, and also to pass on to Dr. Segun Dawodu, who is going to be the moderator for this session. And I look forward to hearing the rest of the remarks. Thank you very much, Chair of the session, Francis, and colleagues, and look forward to the rest of the session. Thank you. Bye-bye.
Thank you, Franny, for your speech. And I would like now to call on the moderator, Dr. Segun Dawodu. Segun is the CEO of PMRAB, Pain and Sport Medicine. He's an associate professor of pain at the Albany Medical College, a physiatrist and a lawyer. He's a fellow and member of different organizations, including fellow of the American Academy of Neuromuscular and Electromagnetic Medicine, fellow of the American Academy of Physical Medicine and Rehabilitation, Royal Society of Public Health, Royal College of Surgeons of Edinburgh, Faculty of Clinical Informatics, United Kingdom, and Medical Leadership and Management. He has been involved in many peer review articles, diagnosis and management of spinal cord injury, Coda-Equina, and Connell's medullary syndrome, swallowing disorders, traumatic brain injury, and comprehensive pain management in rehabilitation patients. And he started one of the earliest blogs in Nigeria known as Dawodu.com, that discusses socio-political issues in Nigeria. Dr. Segun Dawodu, thank you and welcome.
Right, thanks, Francis. Formally welcome the speaker, to this speaker and author, Dr. Adeyi. I've known Dr. Adeyi for many years through Egbe. He's the president of Resilient Health System, a policy analysis and advisory services firm based in Washington, D.C., and a senior associate of Johns Hopkins Bloomsburg School of Public Health. He's the author of the book we're going to talk about today, Global Health in Practice, Investing Amidst Pandemics, Denial of Evidence and New Dependency. In his prior career at the World Bank, he served as the Director of Health, Nutrition, and Population Global Practice, and also as Senior Advisor for Human Development, among other leadership responsibilities across the world. He was the founding director of the Affordable Medicine Facility for Malaria at the Global Fund to fight AIDS, tuberculosis, and malaria. He also co-led and shaped multiple partnerships and studies in global health. Dr. Adeyi earned his bachelor's and medical degrees from University of Ife in Nigeria, Master of Community Health from Liverpool School of Tropical Medicine, Master of Business Administration from Imperial College London and University of London, and also Doctor of Public Health from Johns Hopkins University of Baltimore. Today we're going to ask him a lot of questions concerning the book, but before we start, I will ask him to give us an overview of his book. Dr. Adeyi.
Thank you very much, Segun. I want to thank ANADAC Group for convening this forum, and special thanks to Dr. Franny Lothier for her opening remarks, which really were quite broad and helped us to frame the conversation to come. I will keep in mind your designations of BC and AD and seek your permission to use that framing subsequently. Thank you very much, and welcome everybody. Segun, you've asked me to give a 5-minute overview of this book, Global Health in Practice, and that is what I will endeavor to do. The premise of the book